having a connection fit. I want to kill. No. Everybody in the world. Why would I like you to come out? Hi. Did we not keep the box? Did we keep the box for my fucking Surface stuff? This stuff?
I think so. We did.
But I'm asking you for no reason. I have no idea what the fuck that would be. They're saying that my keyboard is no longer compatible. Even though I bought it from Microsoft.
It's just not working now?
No, because it's telling me to buy a new one. Because I'm not allowed to manually download the driver. Look at me, I could be a fucking dev. Oh, there it is. Oh, no. I see it, though. Okay, wait. I'm really sorry. I'm gonna fuck up your whole... I literally have to fucking pull apart my fucking shit. Mm-hmm. Come on. No, I don't need you to just fucking... Okay. This directory is a collaborative project. Anyone can modify or improve the information gathered on this page. Are you updated on 2020? Are you retarded? Contact us at any point. Contact us to point out any mistake or refine the content. Report an error. Like, the last time you updated, though, was in 2020. This is the fucking Bonjour Sunday website. Like, what are you guys talking about? Like, I hate it here so much. This is fucking crazy.
Last week, I think many of you know we were concerned about what was happening with taking back of the supply, even more so than has been, of monoclonal antibodies. The federal government has stopped sending both Regeneron and the Eli Lilly monoclonal, and that was based off some preliminary studies saying that it may not be as against Omicron, but of course Omicron's not the only variant that's out there, and it's something that we actually have seen applied with Omicron patients, and we have seen symptoms resolve. So it's not clear that this is not something that is going to not be a benefit. It may not be as good as it was against Delta, but we obviously want to have that here for patients to be able to do it. And so we, under Dr. Latipo's leadership, we push back against that. We feel there's no need for it to just be sitting on the shelves. We asked them to stop preventing the distribution of these treatments. And fortunately, yesterday, HHS decided to reverse course, and they are going to be sending these treatments. I think that's the right thing to do. And we're past the point now where we're able to get it directly from any of these companies. The federal government has cornered the entire market. They basically took control of the supply in September. We had done a deal with GlaxoSmithKline on the Citrovimab, which a lot of people think is the most effective against Omicron, and that is no longer a possibility because the feds have an exclusive arrangement. So we have been able to see, though, enough data, both from South Africa, Europe, and now here in the United States, to know, fortunately, that Omicron is far less pathogenic than the Delta variant was. It's characterized more as mild and brief symptoms in the upper respiratory region, and an absence generally of pulmonary symptoms, which really was what made Delta so devastating. But we also know that Omicron spreads far, far more rapidly. I think if you look around the world, any place that has had Omicron in significant numbers, you don't really have a slope. You have like a straight line going up in terms of how quickly it spreads. And I think we've also seen with Omicron, the vaccinations are not preventing infection. Miami-Dade, for example, is one of the most vaccinated places in the country, if not the world. And they've had huge Omicron infections. And so that's just the reality in terms of that this thing is spread very, very rapidly. There's indications and some studies out of South Africa that an Omicron infection may generate immunity against the Delta variant. And that's important because, yes, in Florida, particularly South Florida, we do believe it's overwhelmingly Omicron infections that are occurring. But Delta is still there, and most of the people that get really seriously ill are still being infected with the Delta variant. And so it's important to understand that and be able to have a strategy in place that is going to deal with both of those. And so we're able to be able to say today, now that we've gotten the pathway cleared with the Regeneron, now that we've gotten the pathway cleared with the Bamlanivimab, and of course we want more and more of the Citrovimab to do, we have the ability, and we will immediately turn on additional sites as soon as the federal government gives us a supply. We will do an additional site here in Broward County. We'll do an additional site in Miami-Dade. We'll do an additional site in Palm Beach County. We'll do an additional site in Central Florida. And we also have the capacity to increase of the existing footprint, which we do have a good existing footprint. And we have the ability to add 5 to 10 more sites as the demand may be. But that is all contingent on the federal government sending the doses that we need. And so we're looking at probably between 30 and 40,000 additional doses. This will be used very easily. We've got the infrastructure in place. After we did our sites over the summer, once the demand declined, we were able to effectively mobilize them within each community. So there's some places where the hospitals take the lead. There's others where sites are run, and it's a variety, but people have had access on that. But we also knew that if there were increases in the future, we wanted to make sure that we had the capacity to be able to ramp up very quickly. And so those sites will be up the next day. They're ready. We have DEM, we have health. It's all locked and loaded. It's just a matter of federal government giving us more doses to be able to administer for the Floridians who need it. So that will make a positive difference. And we also had the foresight to ask the legislature in October to set aside money so that we would be able to handle this and there'd be no issue with it, including purchasing our own supply. I don't think we have the option to do that in terms of the federal government's exclusive arrangement, but if they were willing to sell it, we have the ability to buy it ourselves. So that's close to $1 billion that's been set aside to mobilize to be able to treat people, and we're glad that we were able to do that. We also are looking, if you look at the Jackson down in Miami, the biggest system down in our biggest county, they have been putting out data distinguishing the people that are COVID positive in the hospital for something else and the people that are actually being treated for COVID. I think that's an important distinction to make when you have a variant like Omicron, which is much more widespread. You are going to have people who get into a car accident, go into the emergency room, they're swabbing everybody, and you're going to have people that have incidental positives. And so they've anticipated about half of their COVID positive patients within their system are not being treated for COVID. And I think you're likely to see bigger percentages in that regard than we've seen throughout the pandemic. And so that's important when you look, right now in Florida, we've seen increases, but we still have, I think our ICU COVID utilization is the lowest per capita in the country right now. It has gone up like everything has since November, but looking to see who is being admitted for COVID versus who may be admitted with COVID is going to be important to really chart the severity of what we're seeing. And we do think the most severe cases are still the Delta variant. In terms of, we were talking with the mayor about, there's obviously a crunch on the availability of tests. We were promised a lot of these home tests. That's the federal government has total control over that. They've promised hundreds of millions of tests. I don't know when that's coming, if it'll come. Sending it to people or letting them do that without having to go into a line would probably be the most efficient way to do it. If we had the capacity to buy some, we would have bought some, but we can't. It's all going to be done through the federal government. And so I know that there's been promises made in that regard, and so we will see. We have pushed out from the Department of Emergency Management in the last 6 months over 1,500 requests for tests. We've done 50 in Broward County. Now, because of the limited supply, what's asked for, you got to look to figure out, try to spread it around as best you can, and that's what Kevin has done. So there is a crunch on this, and that's just going to be the reality until we get the federal government to start sending more down. But in the meantime, Dr. Latipo is working on providing some testing guidance about who should be testing. I mean, you want to test in order to get a clinical outcome, and that has got to be readily available for anybody, particularly our vulnerable populations who are infected. But I think what you're seeing is there's people who go to the drugstore, they'll buy all these tests, they'll go multiple times a week and go to the sites and test without symptoms. That is just going to contribute to some of the crunch that you're seeing. So he's going to work on putting out some guidance to try to say, let's test for a reason. And if you need the treatment, obviously we want the treatment to be there for you. And I think that'll be something that'll be very well received. So we are ready to go on all this and have been ready for a long time. We do not believe that the federal government should be holding back any more medications. We think we have to offer this, particularly for our elderly population. If you look at Omicron and the profile that we're seeing in terms of the clinical outcomes, it's always been true with COVID that the younger folks were at less risk, but I think that's even more true with what we're seeing with Omicron. And it's just like other respiratory viruses, elderly people are just going to be more, people that have health problems are going to be more at risk from any type of respiratory infection. I think that's what we're seeing with Omicron. So we really want to focus and make sure, and Simone is going to talk a little bit, if you have an outbreak in a nursing home, we are going to send the teams in there to go with the monoclonals, with whatever we can do to be able to help alleviate that situation. And those are the folks that are going to be most at risk on this. The other thing that we're looking at doing, and it's not, the technology isn't where we would want it to be like it would be for, say, distinguishing between influenza strands, but you can sequence these test results to try to figure out if it's Omicron or if it's Delta. When they do the estimates about South Florida, 90% in Miami, they're taking a subset. They're running that through, and then they're extrapolating out to the whole county. So we think it would be something that if you could turn it around quick enough, if you do have a patient who is high risk, but they're not necessarily showing significant symptoms, if you could get it in a decent time, then maybe okay, it's Omicron. Maybe we will focus on the sotrovimab. If it's Delta, well then we'll do the Regeneron or however the practitioners think makes the most sense. But we do not have the technology right now to where you get tested and then you can determine right immediately whether it is Delta or whether it is Omicron. We would need to sequence that. That takes a little more time, a little bit more manpower, but it's something I've asked Dr. Latipo to look at, bringing together with some of our treatment sites so that we can focus treatments the best way that we can. But we are ready to go. We're ready to receive, and we will put all of this to good use. You can bet your bottom dollar on that. And to expound upon some of the treatments as well as the testing, I have Dr. Latipo is going to come up and say a few things.
Good morning or good afternoon. I always have to check these days. Okay, I'm a dad of 3 kids, so give me a break. Completely agree, of course, with what the governor has shared about the epidemiology of Omicron in Florida so far.
Fine. I'll fucking call. I just can't anymore. This fucking stupid can't do anything without fucking knocking everything over and hurting myself. God damn. 765 3600. All right, let's see the fucking Canada's Medicare at work. Let's do it.
Est présentement fermée, sauf pour les patients ayant une place réservée au sans rendez-vous. Pour tout appel relié au médecin de famille, spécialiste ou infirmière, nous vous prions de rappeler lors des heures régulières de bureau du lundi au vendredi. Pour une urgence, veuillez appeler le 911.
Pour les Anglaises?
Pour parler à la secrétaire du sans rendez-vous, faites le 0. Pour les informations concernant le sans rendez-vous, faites le 1. Pour connaître nos coordonnées, heure d'ouverture et notre numéro de télécopieur, faites le 2. As of December 20th, 2021, registration for the walk-in clinic will be possible as of 12:30 for a reservation for the following day on the internet at Rendezvous Santé Québec.
Yeah, I'm on it right now.
www.rvs.
And guess what? You guys said for information concerning walk-in appointments is not available. Please call your clinic.
Received by email or text message the date of the appointment.
Yeah, you have to get the appointment though. That's the issue here. You're trying to charge me? Are you fucking kidding?
Are available for this purpose. Consultations are done in person. As of December 20th, 2021,
I don't care.
registration for the walk-in clinic will be possible as of 12:30 for a reservation for the following day on the internet at Rendezvous Santé Québec.
Oh, no, it's Bonjour Santé Quebec, no? Or are you guys still a lawsuit?
Patients registered at the walk-in clinic are required to complete the questionnaire received by email or text message the day of the appointment. Only patients who do not have access to the internet may call at 9 o'clock in the morning, as only a few places are available for this purpose. Consultations are done in person.
Anything else you want to add? You know what? That is so misleading. You make it sound like it's an automated messaging service. Like, it sounds like the call's going to drop after that.
La clinique est présentement fermée, sauf pour les patients ayant une place réservée au sans rendez-vous. Pour tout appel relié au médecin de famille, spécialiste ou infirmière, nous vous prions de rappeler lors des heures régulières de bureau du lundi au vendredi. Pour une urgence, veuillez appeler le 911 ou vous rendre à l'hôpital le plus près. Pour parler à la secrétaire sans rendez-vous, faites le 0. Pour les informations concernant le sans rendez-vous, faites le 1. Pour connaître nos coordonnées, heure d'ouverture et notre numéro de télécopieur, faites le 2. La clinique est présentement fermée, sauf pour les patients ayant une place réservée au sans rendez-vous. Pour tout appel relié au médecin de famille, spécialiste ou infirmière, nous vous prions de rappeler lors des heures régulières de bureau du lundi au vendredi. Pour une urgence, veuillez appeler le 911 ou vous rendre à l'hôpital le plus près. Pour parler à la secrétaire sans rendez-vous, faites le 0. Pour les infos, veuillez patienter quelques instants. La clinique est présentement fermée, sauf pour les patients ayant une place réservée au sans rendez-vous. Pour tout appel relié au médecin de famille, spécialiste ou infirmière, nous vous prions de rappeler lors des heures régulières de bureau du lundi au vendredi. Pour une urgence, veuillez appeler le 911 ou vous rendre à l'hôpital le plus près. Pour parler à la secrétaire sans rendez-vous, faites le 0. Pour les informations concernant le sans rendez-vous, faites le 1.
Let's just do all the options, okay? I would love to be spoken to in English because it's fucking concerning my health. Wait, je suis sur ligne, là. Your fucking websites don't work, though. Unless I pay you.
Le questionnaire reçu par courriel ou message texte le jour de la réservation. Uniquement les personnes qui n'ont pas accès à l'Internet peuvent appeler à 9h le jour même, car quelques places seulement sont disponibles. Les consultations se font en personne. La clinique est présentement fermée, sauf pour les patients ayant une place réservée au sans rendez-vous. Pour tout appel relié au médecin de famille, spécialiste ou infirmière, nous vous prions de rappeler lors des heures régulières de bureau du lundi au vendredi. Pour une urgence, veuillez appeler le 911 ou vous rendre à l'hôpital le plus près. Pour parler à la secrétaire sans rendez-vous, faites le 0. Pour les informations concernant le sans rendez-vous, faites le 1. Pour connaître nos coordonnées, heure d'ouverture et notre numéro de télécopieur, faites le 2. La clinique est présentement fermée, sauf pour les patients ayant une place réservée au sans rendez-vous. Pour tout appel relié au médecin de famille, spécialiste ou infirmière, nous vous prions de rappeler lors des heures régulières de bureau du lundi au vendredi. Pour une urgence, veuillez appeler le 911 ou vous rendre à l'hôpital le plus près. Pour parler à la secrétaire sans
No wonder the fucking hospitals are all packed up.
informations concernant le sans rendez-vous,
Can't fucking go to a walk-in clinic anymore. Like, what the fuck is the point of having a general practitioner if you can only sign you referrals that are not accepting new patients? Sum up my entire medical fucking history in 15 minutes. Yeah, that's how we do. Efficiency. Oh, social services network are tailored to the needs of people in Quebec. Fucking great. Social services are always... I'll just stay on the phone then. I don't care. Providing social services. Régie l'assurance. I just want a fucking walking clinic, but I think we're just going to go ahead and go there.
Pour les informations concernant le sans rendez-vous, faites le 1. Pour connaître nos coordonnées, heure d'ouverture et notre numéro de télécopieur, faites le 2. La clinique est prête.
Could not find page.
Quelques instants.
What can you do? Return to the homepage. Consult the site map. Search something else. Premier of Quebec. I know who he is.
La clinique
Yep.
est présentement fermée, sauf pour les patients ayant une place réservée au sans rendez-vous. Pour tout appel relié au médecin de famille, spécialiste ou infirmière, nous vous prions de rappeler lors des heures régulières de bureau du lundi au vendredi. Pour une urgence, veuillez appeler le 911.
Walking
Ou vous rendre
government.
à l'hôpital Le
How about a
Public.
walking clinic,
Pour
motherfucker?
parler à le secrétaire du sans rendez-vous, faites le 0. Pour les informations concernant le sans rendez-vous,
This
faites
should.
le 1.
This is
Pour
fucking
connaître
not
nos
right
coordonnées,
to do
heure
to people.
d'ouverture
Like,
et notre numéro de télécopieur, faites le 2.
maybe I'm just that incompetent.
La clinique est présentement fermée, sauf pour les patients. À compter du 20 décembre 2021,
I want to speak to a human.
sans rendez-vous se feront tous les jours en ligne sur Rendez-vous Santé Québec
Yep,
ou
I don't care.
RVSQ à partir de 12h30 pour une place le lendemain. Les patients inscrits au sans rendez-vous doivent compléter au préalable le questionnaire reçu par courriel ou message texte le jour de la réservation.
This is.
Uniquement les personnes qui n'ont
I'm
pas
glad
d'accès
that
à
our
l'Internet
taxes are so high
appelez à
because they
l'heure
do
le
go
jour
to
même
like primo healthcare.
seulement sont disponibles. Les consultations se font en personne.
I mean, like, if you were in the States and you got cancer, you'd probably die.
Présentement fermé, sauf pour les patients ayant
Only
une
I
place réservée
were
au
that
sans rendez-vous. Pour tout
easy.
appel relié au
Should just
médecin de
fucking.
famille,
I don't want to
spécialiste
fucking
ou
deal with this shit
infirmière,
anymore.
nous vous prions de rappeler lors des heures régulières de bureau.
Spend the majority of my life dealing with all everybody else's
Pour une
bullshit.
urgence, veuillez appeler le 911 ou vous rendre à l'hôpital le plus près. Pour parler à le secrétaire du sans
Are you
rendez-vous,
bleeding to death? Go to the hospital.
pour les informations concernant le sans rendez-vous, faites le 1. Pour connaître nos coordonnées, heure d'ouverture et notre numéro de télécopieur, faites le 2. La clinique est présentement fermée, sauf pour les patients ayant une place réservée au sans rendez-vous.
Okay, well, good thing I wasn't bleeding to death. Support for Aboriginal projects. Go to your own hospitals. We'll fucking like let you wait like an extra 2 years too to let you know that we're just gonna send you your own hospital. Fucking why would we give it to you anyway? You're welcome. Social services, fantastic. Become a CHSLD attendant. Yeah, I want to go around and take fucking children away from their parents. To throw them into fucking shit ass homes. With 10 other fucking unwanted children. That we said we would pay for, but they didn't want them anyway, even if we paid for them. I don't understand why you're. What the fuck? Holy oh, wow. Hiring managers at trade pushing blah, blah, blah. This page is so big. Okay. Okay, wait. Use jobs, hiring, trade, career, work, recognizing education. Self-employed businesses and workers. Education. Culture. Oh my god. Family and personal support. Pregnancy and parenthood, childhood violence. We don't give a shit. Pregnancy, childhood, okay. And social assistance, social solidarity, financial assistance. Yeah. Oh, welfare. Roaming? Separation, divorce? What? Elderly, autonomy loss, death. education. Wow, finances, taxes, in my pocket, I'm assuming. Fuck. Housing accommodation, immigration. We'll pay you to do all of it. Fuck your religion. Justice and civil status. Health, fantastic. Blood, organ, tissue donation. Health problems. Cancer, flu, colds, and gastro, STBBI, mental disorders, A to Z. Health assistance or fantastic. Constitution modification, laws affecting health, social services, information. Biosimilar drugs? Oh, knockoff drugs. That's what you guys give me. Technical aids, impairments, and handicaps, rights, remedies, complaints. Let me guess. Page not found. Find a resource. First line access desk. Injection equipment access. CLSC. Find a medical clinic or a GMF group. Find a resource offering naloxone. Offers abortion services. Offers direct debit services. Find your integrated health and social service center. What? Or your integrated university health and social service center? Other resources. Open space. Services for young people aged 12 to 25. What? Online appointment booking in family medicine. Registration with a family doctor. Consult a specialist. Fucking Christ. I just need someone to put a splint on my fucking hand. Open link a new page, I guess. Fuck it. Oh, his face is fucking. Oh god, I can't wait. Community environment for young people offered services. Fucking Christ. Open area service point are free and are provided with respect to your personal information. There are time slots available with and without appointment, and services available during the day, even evenings, weekends on a flexible. But what the fuck are you? Are you concerned about some of your thoughts, things you feel, or behaviors you have? Do you have questions about your lifestyle, your sexuality, or pain? Or you do feel pain? What? Do you have questions about your lifestyle, your sexuality, or do you feel pain, whatever? Are you experiencing family conflict, dating violence, unwanted pregnancy, school failure, or bullying? Do you ever wonder about your sexual gender identity or your alcohol or drug use? Do you need routine exam, health care, or a screening test? Are you worried about your future? Airy Uvert offers various spaces adapted to the reality of young people aged 12 to 25. It is possible to obtain, in particular, mental health or physical health services on site, advice, studies, working, housing information, financial has been developed with the participation for young people aged 12 to 25. What? Grand Riviere, Laval, Nord d'Isle, Montreal, Richelieu, and Sept Isles. Great, now you guys are fucking taking my idea of fucking buying islands. Fuck. Offer services for young people for the continent. What? Other open air services points will gradually open their doors in each region of Quebec. Opinion. The information contained on this site does not in any way replace the advice of professional health resource. If you have questions about your condition, consult a professional resource. It's on literally Quebec.ca /santé/trouver and resource /airy ouverte. That is the full UTRL. Don't even know. Fuck this place, man. Let's just go ahead and fucking post our whole propaganda shit. Oh, good. New notification. Costco 25. New offers with a big Canada flag. Now I know. Thanks. I hate this. I don't understand. Is this not the Quebec government's official website? What is this even? I just need someone to wrap up my broken hand. But walking clinics don't exist anymore, apparently. At least not for us. Just the fucking rich and the fucked. Two kinds of people. I don't... See, now I have to, like, do the thing that I don't want to do, which is basically... Community help? Yeah, sure. What? No, I don't fucking... What?
Fucking camouflage, I can see shit.
Requesting help.
I got a lot of them though so far.
I'll even pay somebody, but not them.
I just gotta kill the ice wall tiles.
But we gave you guys all fucking family doctors. God, like that's not.
Hello?
Anyone on or off Facebook can interact with your public posts. Visit Canada.ca/coronavirus for guidelines about maintaining safe distance from people. What the fuck? Oh my god.
I got one. Oh, yeah.
Someone save me from my government. That I did not vote for. Genuinely tried. I was stoked since July. I've been keeping up. A hole in the head?
Hello?
A therapist? A therapist. None of that free shit, though. Because they're usually more fucked than I am. I know, the struggle is real. I know. Come on. Big bag of dicks. And I like that I could just like put it in the comment section because that way when people go to make a fucking piece of shit comment and we're like, you didn't post anything along with us. Just like,
I'm out of bullets for my
what
weapon.
is this? This is so crazy. Like, you're literally just saying it's okay to fuck around with people's kids without their parents knowing. Like, last updated June 2020. Oh. Oh my god. Notice. Information on the website. Yeah, I know. You mentioned it. There's no way around this, I'm assuming. Don't need an abortion. Oh, it's because we put it in a new window, right? It's fucking nuts. What the fuck? What is this? That's so fucking nuts.
Yes, the camouflage works.
About that.
Hello?
Hey, Mom! What up? My turn. Did you check out the Chattagy Clinic? Why would I do that? Fuck that place. That's why I came here. Now this place is going to shit. I literally almost ended my life over it. Because I just hated that place so much, and here it was just so much better. And now you guys all kind of ruined it with your shitty fucking rented apartments that don't belong in an apartment building. They belong in condos. And there's many for you guys to all fucking choose from. You guys can all fuck each other, and all your fucking condos can fuck each other. Just stay the fuck out of my fucking apartment building with regular human beings that actually give a shit.
God damn it.
This is not normal. Like,
Ow.
it's fucking gross. Oh my god. Like, you have to do it through the Quebec website, and it has to correspond to your postal code. And it's not listening. No.
Hello?
Because you have to do it through the Quebec website. And it has to correlate to your postal code. I'm just trying to follow the rules of not showing up at medical establishments unannounced. So I just really would love it if I could make an appointment to see a doctor that could just wrap up my hand and tell me that I don't have nerve damage yet. Shit is not healing right. And it feels like my insides are being stretched, and my pinky feels like it's not attached to the rest of my hand anymore. But if I wrap it, it's too much pressure. Really, I was going to do my best to just tough it out, but I think we're at a point where it might need a professional. Yeah, you know what? I'll even take Dr. Campbell. guy's a fucking nut job, but shit, he writes me the fuck I want. Like, well, I mean, if you fucking sweet talk him right. Also, for anybody who has fucking Dr. Gamble's a doctor, if you ask you to do a breast exam, tell him no.
Hello?
Because go to a gyno. No, but... Yeah, but you know what I'm gonna say to that. And we can just all save fucking time. He's gonna make a big fuss because I went with the other guy. And he ended up not really liking me too much, so... Because I thought maybe you could talk to your GP and not have to go through your therapist first, because he needs therapy, maybe. Guy's fucking way too old, way too overworked, fucking Westy fucking rich bitch.
Hello?
Then don't say anything, Mom. Shut up. Go back to sleep. Oh my... Maybe I could go to a therapist to wrap up my head. Oh, okay.
Hello?
Wait, what? Maybe you could go to the therapist guy? Wait, what? Thanks. You on drugs?
Hello? Hello?
I tried the therapist thing, but I don't know how many secretaries I can call that tell me are not accepting new patients, even though I have my referral. Main concern, if you want to talk to his secretary who seems to like you, and they want to just give me the referral for the x-ray, we could do that. Or I could just keep going in circles between the website and the phone and not find a walk-in clinic and just tape the shit out of my hand. I have tape that'll be fucking no charge, no charge. Slightly, but I can't do anything. Something's fucking not attached. Really? 51 or 55 minutes? There's no way. That was weird. Can you get the analytics shit? Well, I guess I'll find out if what's his face. Ryan. Yes. You guys are fucking gross. I don't know why I bother. Oh, look, now I get notices on my fucking pages that curfew is in effect. Quebec, what? Quebec health file. Vaccine registry. Fuck. Fuck. Only for. You know what? Well, we're gonna come back to this. Mm-mm. Sherbrooke. H2L? That's too much. Oh, fucking Ormstown for all I give a shit. How is this? How is this possible? Like, how is this legal? Huh. Wow. Organization that helps sexual abusers, or organizations that help sexual abusers. I would assume that is just like that is the language translation fucked up. Organization that helps people who are victims of sexual assault. Okie doke. Apparently not. Regional resources for the breast cancer screening program. She doesn't like me either, Matt. But the fucking she likes me significantly less though. So list of midwifery services? What are you fucking pop them out? Just keep popping them out. Boom, boom, boom. Your relationship sucks? Have a baby. Mad at your parents? Have a baby. Afraid your boyfriend's gonna leave you? Have a fucking baby. I do have a family doctor, but he doesn't like me, so. Ha 514-doctor. Yeah. 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 Oh, yep. Okay. Oh. Ugh. I'll get back to you on it. Wait, what about being white girl wasted? You're gay. Terrebonne, Laval, Plainville. I hate you. Is it because it's like an English clinic? Is that why? It's like... What? Are you... What is that? What is your fucking deal?
Hello?
Oh, okay. Okay, I'm so sorry. I thought my computer just keeps fucking up because it's garbage. Yeah! Gotta put a cast on first, then we can go punch the shit out of stuff.
Hello?
Well... Okay, I guess we're not gonna do that anymore. So, while we wait.
Hello, Eileen. This is Jean. I just had a letter from my brother, and guess what? He's bringing his roommate home from college. Mother said we can have a party for him, so I was wondering if you could come over tonight and help me plan it. Yes, Nora's coming too. This is one party that just has to turn out right.
Well, the purpose of a party is to have fun together. And a successful party needs planning and skill. Whether it's a special carnival designed for gay entertainment, or a game party in a home, a birthday party, a holiday party, they all take planning, and they should all be fun. Now, the party Jean, Nora, and Eileen are planning What of its purpose?
The main idea is to introduce Steve to the game. And show him a wonderful time. Yeah, and show everyone a nice time. Right. Now listen, this is what we have to plan. A guest list, invitations, refreshments, and entertainment. Now, a guest list. Who will we ask? There'll be the three of us and our dates. And I suppose we could have an extra couple and 2 extra girls for Jim and Steve. Now, who do you think, Nora? Well, let's have Alice and Ted come. They're nice, and they're usually in our gang. Margie's lots of fun. The fellas would like her. That's right, Eileen. And let's ask Dot. We certainly had a wonderful time at her party last month. Oh, awesome. We all enjoy being together, but is anyone left out? I don't think so. Well, that's our guest list. Now, invitations. Should we write? Dear Alice, would you like to come to a party at my house Saturday, March 24th at 8 p.m. and so on? Why bother to write? This is just an informal party. Let's just phone everyone. Sure. Good. We'll phone tomorrow. Next business, refreshments. We have to feed the men. And the girls, too. Especially you. Gee, thanks. Does it show? Well, we want something to eat and something to drink. Refreshment. How about hot chocolate and sandwiches? I'll fix the sandwiches. Well, thanks, Eileen. Suppose I talk it over with Mother and get her suggestions. All right. All right, now next is entertainment. We want to show Steve a good time, but, well, we don't know too much about what he likes. The best thing I know for breaking the ice and getting people acquainted is some good mixer games. Oh, but they can be such a bore if you don't have good ones.
Like,
Go to
Cam.
the library and get some.
I was like just on the longest time, just like, and it makes it sound like it's an automated message that's about to hang up, and it's just not, and then it just puts you in a loop. You get option 1, which is specialist. I think 2 was if you don't have an appointment and you want information or something, and they just refer you to this website. This is really fun, honestly. It's
so cool.
It is very cold out there. They bring you to the Quebec medical appointment scheduler, which just puts you on a loop of not helpful information. That is some other fucking crazy Quebec shit that I was looking up. So this is what we're doing now. Quebec health file. Because I was just like, there was like 3 options. Medicare, the health file thing, and then there's the vaccination registry. I'm like, what the fuck is a Quebec health file? So this is very fun, and I don't know when this was put in, and I don't know why this is okay. What the description says is the Quebec Health Record, the DSQ, is a secure provincial tool that collects and stores certain health information from all people receiving care in Quebec. This is an automated and mandatory process that does not require the action of any professional. I'm really happy about that when we're referring to my health. Certain authorized interveners have access to your DSQ and can consult the information it contains. The DSQ is therefore not accessible to all health and social service stakeholders. The people who pay for it, I think. Stakeholders always means the people who are putting the money on it. Because, like, where does all this money come from, right? Not our taxes, obviously. No, apparently it comes from shareholders and stakeholders. Which is like Elon Musk, fucking the guy, fucking the robot dude who's not real. Facebook, whatever his name is.
Yep, Mark
Zuckerberg, yes. All those fucking Bill Gates. That's another big one. Fucking. Wait, but I want you to call me on here.
You can answer down there.
Where?
Facebook.
Too many pages.
You play Mario?
I have no idea what that is.
Then you go to Zelda or something.
Is it actually? That's how long it actually took to connect. Isn't that like premium fucking technology is right there? I'm fucking tearing my I had literally had to like tear my room apart to find this stupid fucking box because apparently my fucking keyboard is not compatible with the Microsoft device, even though I bought it from Microsoft.
I bought it. It came with the bundle.
Yeah,
It
but
should
the
work.
Windows update for Windows 11, it fucked it all up because they didn't consider that fucking Surface is all on ARM programming or software, I mean. So it fucking didn't like fucking update right, and they were like, "Don't worry, we fixed it." And it's telling me to fucking, I know which driver it is. This is what all this shit is. These are my computer's error reports. Dom, listen to this. I could be a fucking like a coder, like. So what you have to look for? This is my actual device manager because Windows is overriding all this software, and it automatically will just like be like, oh, we're rerouting you to Windows fucking Microsoft fucking app, whatever. Because this was what it runs on, apps. This is my actual computer. So you have to, this I've been doing for months, and this is the first time a little exclamation mark came up. Because that's what you're looking for. You're looking for devices that have been, the software has either been updated or changed recently. So that is Microsoft Wi-Fi Direct Virtual Adapter number 2.
Okay.
Is what's fucking all this up. I could fucking be a coder or like a dev or an IT person. Broke everything. I could do way more than the Microsoft people can do.
This is like.
What the fuck?
I just gonna tell me if I just can't. Did you find a GP? Like fucking yeah, I know. You guys are gonna find me a GP, and then you guys are gonna be like, oh, the native people fucking will make them wait an extra year and a half just to refer them to their own fucking hospital. I could have fucking done that myself. Anyway, I'm a conspiracy theorist. It's fine. Anyway.
Alright. Yeah, Tony had to come back to work from home now, so.
Oh yeah, so you guys are trapped together again. Aren't you glad you guys took that week spending it together?
My sanctuary is gone. Can't blast my fucking crazy music in the morning anymore.
Yeah, well, you can, but you can come set up work at my house. I'll make this your office. And then you can train me, and then me and you can just work from home together in this room. And me and you can live in this room forever and never leave.
Yeah. Send a ransom note one day. You're just like, do you want her back? You can't.
No, you can't. No, there is no ransom. There's no amount of money you can pay for her. That's why I got a dog. He's my prisoner forever. And literally, he just like has to deal with me. It's great. Can't say anything.
I'm take you really far away, though, so you never see Madison ever again. I think she'll like pull Liam Neeson on you. If anything, I'll put Madison away and see how far she gets out. She will. She's like a ninja.
You know what? It's funny though. People used to tell me that like I used to get told that I should be a private detective, and then when Jessica Jones came out, people were really like, I'm like, I'm like, aren't I just like doesn't it mean I'm a creepy stalker? Like, I'm
just
good
like
at
a fancy way of saying stalker.
I'm good at being a creepy stalker. Great, thanks. I'm flattered. But yeah, no, I'm really good at finding people who don't want to be found.
All of my academy training.
Dude, I was like a 6-year-old watching what's that show, How to Catch a Predator, with my mom, and I told her I want to do that, and she was like, "You want to do what?" I was like, "I want to be the person that goes online and is like fucking luring people who are predators."
But I'm just gonna fight the predators when they show up.
Yeah,
I'm just gonna stab them.
No, we're not gonna have cops there to arrest them because they already know that it's a setup. But I'm gonna just beat them up.
Public execution.
No, word for word, I just saw on the Quebec website that there's a link at the bottom, and it's support or help for abusers, sexual abusers. What? I'm like, is that maybe this is like written wrong? But no, I think it's written right. Quebec's fucked up. Quebec's fucked up.
Bruh. Stop. Why are you blowing in my ear, man?
Tony, you want to fight? Like, I'm down. I'm down to take my anger out on you. Go.
I can't hear you, man. Speak up. Stop mumbling.
Let's fight. Wanna go? Take a walk? Have some words?
You gotta freed yourself out there.
I'm a hobo. I'm used to it.
I'm gonna fucking die.
Yeah, no, it's like fucking disgusting cold out, and why would anybody want to live here anyway? Like, it's just like
it was like minus like 20 this morning, and our door has like no insulation, so like one half of my body is frozen, the other half is like mildly warm, and I'm just like, this can't be good.
My truck didn't start because it's too cold.
We're going to Vegas. After bags. Fucking Vegas.
Florida, no, I want to go to Florida because they have like no mandatory fucking shit.
What? Yeah, my friend just came back from there, and he said like they don't. Nothing is mandated. Like,
yeah, but
like, I still wear my mask because Florida people are crazy as fuck, and I was like, that's fair. Honestly.
Yeah, but like that's fucked up. That Florida, of all places, the place where you like you don't stay in Florida, you pass through Florida, and you can watch some of the crazies for a bit, and then like you're like, oh my god, but then you leave. Florida right now is the most sane place to be, apparently.
Fucking nuts.
What are we doing?
Trudeau, my friend said you think Trudeau apparently was like, people that don't vax, usually they're misogynistic, they're racist, homophobic, anti-feminist people. He just like
that's a whole lot.
I was like,
that's a lot. So many wrong things that were just stated. What?
I was like, that's not the same at all.
Yeah, no, this is a new thing that we keep doing, comparing things that are not comparable.
I was like, what does being like not wanting to get like a fucking another vaccination have to do with like being like racist or homophobic?
They go hand in hand. They're just sadists, fornicating.
I was like, what? Oh, anti-religion and also anti-science. That's what also he said.
Anti-science. I like this. Misinformation.
Anti-science. I was like, well.
Yeah, no, people are fucking losing their shit and being crazy, but like I don't understand why everyone's also so complacent. Like, I'm kind of just like, and they're like, well, I get that it's also just cold out, but like they're like cops also don't want to be doing it. I'm just like, okay, this is obviously why cops became cops, right? Like this is why they became cops, to stand in fucking intersections and for this.
To ticket people.
Apparently you can't walk your dog. Yeah. Apparently this time you cannot walk your dog after 10 o'clock.
Why? That's fucking stupid, dude.
Do I let him shit indoors? Do I make him hold it? Like next time your kid wants to use my bathroom at the fucking mall, guess what? Your kid can fucking piss in their fucking pants then. How about that? Do you like when people say that to you? No, you don't. Because I'm a human being and I'm not going to let some kids suffer because you're a fucking piece of shit. Like,
yeah.
But, like, you know what? This is Legault having a temper tantrum. That's what I think. Because Trudeau's not scratching his back. Like, Trudeau he scratched his back when fucking Trudeau wanted to get elected. Fucking now fucking he's like, oh, I can't follow through on our end of the deal, and I'm gonna start fucking I have to start speaking out against, I don't know, the racist fucking Muslim man that we're talking about and dealing with. That finally Quebec is on the map for fucking international news, or fucking national news. Guess what for? Being racist as fuck and firing our fucking government our government workers, which we are short-staffed.
Yep.
But we're gonna fire the ones for wearing what is the obsession with hats? Everybody's got a fucking hat.
Honestly, it's fucking so ridiculous to me. Like, I think people could be like, and if people are like, oh, well, this is just now. Like, this has been like this for fucking years.
Masking mandatory, face coverings illegal? What are you talking about? We're gonna pay you to come here. We're gonna fucking put you through school, but you can't practice your religion. You can't speak your own language out loud in public. Like,
yep.
I don't understand what's going on and why more people aren't like, and it's just like, I don't know. A lot of people seem to be like, you're a shit disturber. Why do you need to go at after 10 o'clock anyways? And it's just like, why are you making such a big... I'm like, this is not a big deal, really? Am I like, maybe I am fucked in the head, but this is like fucked up. You can't do this to people. Because you're fucking... What? Because your hockey team sucks and like fucking there's no chance of you guys making the playoffs and you're taking a tantrum? Is that what's going on?
I don't know, man.
I don't know either. But like there's no science, and they said even last curfew, I already knew as soon as they started talking about lockdown measures, I knew that curfew was coming. Like
they said it didn't even work last time.
Yeah, and they're gonna implement it again, and they get away with it because they get away with everything. They do whatever they want, and the cops I get that are like, we don't want to have to do this, but then don't just don't do it then. Like,
yeah,
I'm sorry, use your brain. Anyone who has more than half a fucking brain and isn't just like getting a paycheck, like be a human being for fucking 2 seconds and use your fucking brain. I know people don't like being uncomfortable.
too bad.
Confrontational. I just don't deal with conflict very well. It's like, yeah, I know it's an uncomfortable subject, but guess what? The rest of us are affected by this. Like,
welcome to the real world.
That's what I'm saying though. Like, I get shit is difficult and people don't want to think or deal, but guess what? Yeah. This should be unacceptable to be able to get away with this. Like, Legault's gotta go. Like, this guy's a fucking... This is a dictatorship, like, at this point. Like,
yeah, 100%.
I'm down for Russia. Fucking climate's about the same too, so... At least Putin tells you to your face that he's gonna torture people in jail. He fucking tells you, oh yeah, by the way, we're watching literally everything. Like... Here they're just gonna be like, no, freedom. You have rights. Yet I'm fucking
Canada like as that type of place too.
Yeah, but like that's why we have the federal and provincial, and for Trudeau to not do anything, like he's not saying anything, he's not doing anything, he's going on fucking vacation every 2 fucking seconds. Yeah. Fucking that Krista Freeland bitch. She's the real fucking prime minister. Honestly, she's the only one who I ever see doing anything and running the show, and Trudeau's just a fucking dumb bitch boy. Who fucking daddy gave him a job. Like,
no, I'm waiting because you're playing time, right? Yeah. Now, I'm moving tomorrow into the bedroom. Okay.
What? Can't hear you.
We're trying to figure out where he's gonna put his stuff for work. Cause like, I had all my shit set up. Like, I have the bedroom for like my gaming stuff, and out here was my work stuff. Mm-hmm. So. But like, to move everything all over again is going to be like a huge fucking pain in the ass. So he's just going to...
Let's get a house.
Get into my monitors in the bedroom.
We'll buy a house together.
Oh.
I like how Tony and Cameron actually just both made the same sound.
Oh, ain't gonna happen.
All right, fuck you all. I'm going to go squat somewhere then. I'm gonna go find a very nice empty building out of all the many empty buildings that are fucking decrepit and falling apart, and I'll just go squat there, and that's gonna be my new home.
Just steal it.
No, that's where I'm getting to now. That building that is next to you guys.
Oh no, they were building stuff in it already.
Oh yeah. I wonder how long that building was sitting like that before it was though, and how many more there are.
It's supposed to be like student housing, I think. Yeah, student housing.
Well, I noticed like down at the canal where the fur trade place is, they've been like fucking doing a lot of construction work down there, and I thought like a lot of it is like, oh, heritage. I'm like, then why is it a bunch of white people who are fucking part of Lachine who are hiring contractors to come do work on what is the fur trade? I'm assuming you guys are really going to be attentive to depicting the culture accurately.
No.
And I'm surprised Native people aren't like, yo, why is there a bunch of construction around the fur trade buildings? Like, oh, I'll go live in the fur trade. I told Cameron that. I was like, we should just go to the fur trading post down there and just like be like, We're here now, so you guys can leave because native.
Native.
Yeah, native. This is we live here now, so you guys can go away because this is not your land. It's not your property. It's not your building.
You don't even go here.
You don't even go here. I need somewhere to go because I can't be here anymore. Can't do it. I can fucking blow. What are you making?
I'm cutting stuff to make steak subs, so like peppers and onions and celery.
Jesus. Fucking, what's that guy's fucking name?
Jeff Ramsey.
That guy. I like when he does the kids one and they're really going to let him do like cooking with children. It's like, he's like, I'm not fucking much. I don't swear at children.
He's like so nice. Then he's like, "Oh, my precious boys, precious, so good,
his
so nice."
wife, he's like so insanely like sweet and like in love with his wife. It is disgusting and sad, and it makes me sad and like. Bleh. But it's so cute how much he loves his wife and children.
Yeah, his kids are. Yeah, he really loves his kids.
Yeah, but I like that too. Maybe they're like, oh yeah, he's gonna be totally fucking like Hell's Kitchen with fucking children.
Like, just the difference of him with adult kids. Like, adults, he's like, you fucking moron, just fucking kill yourself. Because he's like, you are precious until then anybody tell you otherwise.
Well, he fucking says, like, a lot of that is acting. Like, that's the show. Like, Hell's Kitchen shit. Like, it's not fucking la-di-da Coronation Street kitchen. Like, type, cover, pen, model. Is it okay? Fast, accurate typing. You must accept enclosed warranty agreement.
What?
It's because I'm trying to figure out how to get my fucking laptop to work. Because they were like, you're still under warranty, so technically you can just send it in. But like, I don't want to send it in. I want them to refund me my money and take it back.
Yeah, you're like, I don't want it anymore.
I know, because it's unreal how bad it is. I can't believe that it ever got to market, to be honest. Like, and this is the downfall of Windows. And Windows used to be actually a pretty good company. Maybe not fucking the most fucking, what do you call it? Ethical? But that's not in my fucking business. I just want it to fucking work because I paid thousands of dollars for it. Last time I bought a computer was 2005. It was a Dell. It lasted me over a decade.
Jesus.
My Dell fucking tower, I still have the actual tower. There's no hard drive in it, but like that thing, it was just the best. So much LimeWire porn. How the fuck does that even happen and my computer could survive? Like, my fellow Americans, I did not have sexual relations with that woman. However, I did go to www.
Porn.com.
You're funny. I remember I tried to find the Holes movie. I was like, oh no, this is a lost cause.
No, this is not the right Holes movie.
Oh yeah, no, I gave up immediately and I was like, okay, I'll just go see if I can find physical copies. Okay, wait, you have a QR code scanner thing.
Are you talking to me or your keyboard?
My Cameron. Warning, choking hazard. My keyboard could be
Don't eat it. Don't do it.
Dom, they decided, because their fucking customer support, once again, is non-existent. It lasted about like a week probably. Once again, non-existent. Now they added these like weird fucking videos on their troubleshooting pages, I guess is what you would call them. They also make you download a fuck ton of weird apps like tips. Just the tip.
Oh, okay.
Help. That's another what is the new one? Microsoft Mouse and Keyboard Center. Not supported, device detected. Thanks. Like, wow. If you wait, I can do that. Wait, let's do that fun stuff. Share. Is that... Okay, that's cool. Cameron, what are you making? Oh, that's neat. Okay. So
why
yeah.
Are you looking? Why are there like 3 versions of me?
A box and a box and a box. See, look, this is the shit that I'm dealing with. That's what the Windows website told me to do, is download this app, Microsoft Mouse and Keyboard Center, and this is what they gave me. Not supported, support Microsoft device, troubleshooting device setup, like Bluetooth, and I'm like, it's not a Bluetooth. There's no fucking input for any USB whatsoever. It's a 2 USB-Cs on the side that also don't work.
What?
I can't do this anymore. And I can't talk to a human being to help me. I got a $280 warranty.
Why?
And I was supposed to come with a standard warranty. And a standard limited warranty means nothing. It says you have 90 days with customer support, and that's all they give you. And then customer support no longer exists.
What the fuck?
I don't know, Dom. I can't do this, though. I just want to know. That's a different language. Okay. I just want to know what generation it is. Because there are so many different kinds, and they're also separately. I'm really glad I kept this stuff. I give Cam shit because he's got like a weird box problem. He wants to throw everything out, but fucking is obsessed with keeping boxes of everything.
Yeah, Tony keeps everything. All the boxes.
Okay. You know what? Never mind, it's fine. I say nothing. You must accept enclosed warranty agreement. Sourced from Italy. Did you know?
Who?
My keyboard is sourced from Italy. Alcantara. Something is a unique and innovative material used in high-end luxury products. Not quality or fucking reliable, but just what I was looking for. Fashion over function. That's my new fucking phrase that I heard the other day, and I was like, that's great. That's exactly what it is.
I just ordered a new keyboard too, actually, yesterday, and it's coming like tomorrow. It's like pink and it's like rainbow colors and shit.
Well, I saw that, what is it, the Alienware fucking one laptop that I want now? It's like 19-inch. I was like, ooh, 19. You don't even fucking see those anywhere. Mine's the biggest, and mine's a 14.
Oh, yeah?
Something like that, but, like, it still is, like, I guess it's, like, an okay size, but, like, apparently the inch makes the whole difference, like, or no, mine's 15, and standard is 14, I think. Something like that.
I think my laptop screen, too, is 15, I think.
Well, like, apparently 15 is, like, if you want, like, expanded experience, you want to get the full experience.
Oh, boy.
Yeah.
I just want it to work, honestly.
I just fucking, you know what? This applies to every aspect of my life right now. I just want it to function to standard, basic, bare fucking minimum.
That's all I'm asking. Not even, like, overachieving, just the bare minimum.
Oh my god, why is that so much to ask for? I'm just gonna duct tape my hand at this point. It hurts so much. You don't understand,
Did you call any walk-in clinics? I think there's one in Verdun.
Yeah, the one I usually go to, the line, it just drops immediately. And then there's this new number that they tell me to call, and it's an automated service with like 3 options that just basically refer you to their website to Bonjour, Santé, Quebec, whatever the fuck it's called.
Oh, yeah, Bonjour Sante. So what you should do is you should call Info Sante, tell the nurse that you cannot get a fucking appointment and you need one, and they'll do it for you.
I'm just gonna go there tomorrow. Like, I'm just gonna go walk there because I'm trying to follow regulations of not showing up to medical establishments unannounced. Like, but if no one's gonna fucking help me, like, and it's solely because I'm English.
Is that right?
Oh, all of these message, like automated message, everything, there's no option. Even if you press 9, it doesn't go to English. There's no option for English. And I'm like, I'm really glad about that because we are referring to my health. It's all good, bro. I'm trying so hard. I got so far in the end, it doesn't even matter because he killed himself.
Tried so hard, not so far.
Oh, I know, fucking such a beautiful man. Isn't it so sad that seeing, like, now you're like, oh, look, every song he was, like, screaming how much he was gonna kill himself. And then he killed himself.
I
and
thought
everyone
it was
like,
relatable then, let me tell you.
And now it's like, oh, it's so sad. Oh, gone too soon. Thoughts and prayers. It's like every song he's ever made is basically him telling everybody he's about to kill himself. But he's so talented. I can't drink water.
Why?
Because I don't like warm water. It makes my tummy feel weird. So, like, I can't drink cold water without my tooth hurting.
Yeah, ice cube?
Well, it's because, like, I have to use a straw, but it makes my tooth hurt after.
Okay.
Because I have to get the cold past my tooth.
Oh, yeah. It's true.
Honestly, it's like my lowest, on the lower end of my priority list.
Well, as long as it's not, like, majorly fucking you over.
No, I just can't eat a fudgesicle without fucking being upset. I like fudgicles. Alright, so I'm gonna come steal you, right?
When, tomorrow?
Aww. I was gonna say now.
Yeah.
I guess tomorrow because I need you to. Don't say.
Yeah, because the curfew's at 10 tonight and I have to work.
Yeah, curfew can suck my left nut.
I do not want a $6,000 fine.
I'll pay for it. Like,
that's all tickets to pay for.
Honestly, if someone wants to give me a ticket for being by myself after curfew, like, then go ahead, give me a ticket. I don't care. I really don't. You're gonna give me a ticket for walking my dog. You're gonna give me a ticket for him being off leash when he's standing right next to me, like in like the place that I've been fucking walking him on the same block the same way for like years. It's okay. They're gonna give me a ticket regardless, right? Like ever since I fucking like the credit thing, whatever, I was like, you have bad credit. I'm like, why do I have bad credit? I don't own a credit card. I've never owned a credit card. And they're like, well, because you don't have a credit card. This is why you have bad credit.
What do you want from me?
Well, you should just get a credit card then. I was just like, but I can't get a credit card because I'm telling you that I'm going to fuck it up. I can't win. And I was like, hey, Dad, guess what? I always thought it would be your debt I would inherit. I got this, though.
I got my own. Thanks, though.
No, I got this covered. Don't worry about it. Like, now that you guys are out of debt. You know what? At least I'm not living inside me.
What?
Hold on. I'm off the full only. There's so much bologna in my mouth.
Oh my god.
Why do I eat like I'm a fucking animal? Oh, I got hair in my mouth. What were you talking about?
I have no idea. We jump from like 30 subjects, honestly.
Because I have to catch you up. Because you fucking been bailing on me.
Yeah, well, come get me tomorrow. Like, I finished 3:30. Come early, like, on the dot if you want.
Okay.
Get your white ass up.
Yeah, because I have to
Where are you going tomorrow? Can I speak, please? I'm talking. Yeah, I'm in conversation right now. Don't be rude. Can I make the plans first and find out if I'm going? Relax.
You can come too, Tony. Hey, I was just eating bologna too. See, that way you know, I call you baloney because and I'm full of it.
What you say? I can't hear it.
I love you. That's what I said.
I only love dogs. Sorry.
Oh, your boyfriend's funny. Okay, sorry. Go on. It's Tony done being nosy then?
Yeah.
Okay.
So then tomorrow, if you want, yeah, like I said, just come for like 3:30 and we'll go.
Okay, I just have to make sure.
Yeah, let me know because if not, then if it works better Wednesday, let me know for Wednesday.
No, I'm gonna because like Cameron's birthday is on the 5th.
Okay.
See, look at me. I'm figuring out what day it is today, and scheduling. I have to look at a calendar for the first time in fucking this year. Which is on the Wednesday. So tomorrow I'm definitely gonna need you because zero inspiration for this one. So I'm gonna need help. Yeah. But I got fun stuff like fondant and stuff.
Oh, I'm down.
I think he heard the word fun, so I think he already knows now. Stupid idiot.
What? That's fine.
If you have any ideas, fucking doodle them and send them on over.
I'll take a little look around.
Okay.
And I'll let you know.
Okay.
I think I have some tools for that too in my cupboard.
Oh, fun! I love stuff like that.
Yeah.
And I should actually go steal some from my sister because she has like the Michael's fancy schmancy shit.
Oh, okay. Yeah.
Cake boss.
Nice.
I'm so bad at being secretive. I was like, don't say that word. God damn it.
Yeah, that's why I was like, tool.
Ding. All right. Okay, so I'll be there fucking on time. Because I have to leave like before. I have to be past the 20 before 2:30. Because after I don't know why traffic starts at earlier now for whatever reason.
If you come a little bit earlier, that's fine too. Like I don't mind. You can like come chill also.
Okay. Okie then. I'll let you go eat while I destroy my home.
Okay.
Alright, love you.
I love you too.
Bye, Tony Baloney. Guess what? You don't get I love you this time.
Bye, Madison.
Yeah, you don't love me. Fuck you. Bye.
I love you.
Holy shit. You might want to open the window. Very smoky in here. Yeah. Huh? Oh my god. It's so cold. Mm-hmm. $6.30.